Hello all, myself Nitish Kumarche. I am an admin of Nature's Law of Cure channel. I completed my BHMS at GHMC Bengaluru. Presently I am pursuing an MD in NIH Delhi. So we are starting a live classes for APGT 2024 of medicine and pathology subjects. So for the first 25 student it will be a free registration. The further adding students will be charged for 400 rupees for two subjects. So in this 400 rupees, 2 to 3 live classes is held weekly, and also doubt clearance, MCQ solving, group discussion is held. So this is a sample video of MCQ solving which was asked in APGT 2023 regarding the respiratory system. The question is PFT in case of acute exacerbation of asthma. So I have summarized this question in terms of whole obstructive lung disease. So asthma is nothing but one of a type of obstructive lung disease. So I summarized in with an example of COPD and other obstructive lung disease. So if you like this sample video, you can start registration for the live classes. And I'll definitely keep my quality in terms of clinical approach and as well as APGT approaches to be in a high. Registration starts from tomorrow. For further more information, you can DM me on the Instagram on the page Nature's Law of Cure. Thank you and watch the video. Which of the following pulmonary test findings are found during an acute episodes of bronchial asthma? So this is an APGT 2023 question. So this is a multiple correct answer question. They have given a 4 choice. Out of 4 choice, how many of them are correct in terms of acute episodes of bronchial asthma? So this kind of multiple correct answer questions are more common nowadays in APGT along with assertion and reasoning based topics. How do we approach this kind of multiple correct answer question? First, we have to focus on the key points in the question. So they are asking for pulmonary function test findings are found during an acute episodes of bronchial asthma. So choice A is decreased peak flow rate, and choice B is decreased FEV1, and choice C is increase in FEV1 by FEC ratio, and choice D is decrease in FEV1 by FEC ratio. Choose the correct answer from the options given below. Choice A, choice B and choice C is only correct. A and C is correct. B and C is correct. A, B, D is only correct. So another thing in the approach of this kind of questions is having a root knowledge in the subject. So without having a root knowledge in the subject, so this is very difficult to answer this kind of question. So that's why a root study and the root knowledge is very much important to approach these kind of questions. To understand this question, we need to have a knowledge about the spirometer. So let's study about the spirometer. Spirometer measures majorly of 3 units, so which includes forced vital capacity and force expiratory volume in 1 second, and the ratio FEV1 force expiratory volume in 1 second by FVC. Out of these 3 units, this 2 is very much important. Let's look at what is FVC. So forced vital capacity is a total amount of air expired after taking a deep forceful inspiration, which means forced vital capacity includes tidal volume plus inspiratory reserve volume and expiratory reserve volume. Tidal volume is the total amount of air or the volume of air which is moved in and out of the lung during a normal ventilation cycle, which is around 500 ml. So inspiratory reserve volume is the extra volume of air inspired with the maximal effort after reaching the end of normal quiet inspiration, so which is around 3000 ml. Plus expiratory reserve volume. Expiratory reserve volume is the maximum amount of air which is breathed out of the lung during an expiration, so which is around 1100 ml. So if you sum this total, FVC in a normally in an apparently healthy individual is around 4.6 to 5 liters. Let's take an example of 2 persons. So one person is suffering from obstructive lung disease and another is apparently healthy individual. So the person who are apparently healthy individual can expire this 4.6 to 5 liters in a 5 seconds. So the same volume of air can be expired by the person who are suffering from obstructive lung disease, obstructive OLD. I'll write here as a OLD, obstructive lung disease, can take around 15 to 25 seconds to expire this 4.5 to 5 liters. The problem with FVC is not having a time equation. At the end of the pulmonary function test, the result will be in an apparently healthy individual, FVC is normal, and the FVC in the obstructive lung disease person is also normal. How can it be? So because we are not having the time equation in the forced vital capacity, so we are making false results. I mean, in the sense, so normal person can expire this 4.5 to 5 liter in a 5 seconds. So the same amount of air can be expired by 15 to 25 seconds in a deceased person. So because this forced vital capacity cannot differentiate between the normal individual and the diseased person, so that's why there is an important ratio to know what is called as FEV1, forced expiratory volume in 1 second. So we have seen that forced vital capacity is around 5 liter in an apparently healthy individual. So what does it FEV1 signifies? Forced expiratory volume in 1 second. So which means in a normal or an apparently healthy individual can expire 80% of this 5 liter in a 1 second. Means 4 liters. So you can expire 4 liters around in a first second of the expiration. First second of expiration in a normal individual. And then the 1 liter can expire the next 4 seconds. So but the deceased individual, FEV1 in an obstructive lung disease person, so he can expire this amount of air, I mean 4.6 liter to 5 liter of air. So he will take around to expire this 4 liter around 15 seconds. So we can make a difference that who is obstructive lung disease person and who is apparently healthy individual. Okay, so this is why FEV1 is very much important to differentiate or to diagnose in a obstructive lung disease and the respiratory disease cases. And these forms a very important ratio, what is called as FEV1 by FEC ratio. So which is more than 80% in a normal apparently healthy individual person. Now we'll see what happens in obstructive lung disease. So obstructive lung disease is basically having a pathophysiology of two phase. So it's going to with hyperinflation phase, which is a early phase, air trapping phase, which is late phase. So in case of obstructive lung disease like COPD, so there is lack of elastin. So this lack of elastin causes a decreasing in elastic recoil pressure. So lack of elastin, for example, you can take a disease called as emphysema. Emphysema, it's a form of COPD. There is a destruction of elastin, so that's why there is a lack of elastic recoil pressure. So this amounts for decreasing elastic recoil pressure. So this decreasing elastic recoil pressure causes the lung compliance to increase. So lung compliance on the contrary increases. Okay, lung compliance increases, elastic recoil pressure is decreases. So net result is it is very easy to inflate the lung due to this lack of recoil pressure. So that's why there is increasing in FRC and residual volume. So what is this FRC? FRC is the amount of air which is left in the lung after normal expiration. So residual volume is amount of air which is left in a lung after forceful expiration. So I will take a new slide. So FRC includes residual volume plus expiratory reserve volume. So residual volume and expiratory reserve volume. So FRC and residual volume both are increased due to increasing in the compliance of the lungs. So as I said, there is lack of elastic pressure. As I said, there is lack of elastin. So this mounts for decreasing in elastic recoil pressure of the alveoli. So this decreasing, whenever there is a decreasing in elastic recoil pressure, so when you try to inflate a lung, so it can easily inflate due to there is no resistance. So this elastin is making a resistance during an inspiration, so and along with the surfactant. So this due to this lack of elastin, so the alveoli become easily inflate, or the lung become easily inflate. So what happens is, when you can easily inflate, the compliance in the lung is also increases. So this mounts for increasing in forced reserved volume FRC and residual volume. When you try to expire forcefully, the airways become closed or collapse. Why? Because the driving pressure which is required to drive out air from the airways is always a sum total of intrapleural pressure plus elastic recoil pressure, which is intrapleural pressure. So this intrapleural pressure is positive only in a one scenario, that is forceful expiration. During the forceful expiration is the only scenario this intrapleural pressure become positive. So this intrapleural pressure plus elastic recoil pressure must be above your airway pressure to drive out the air out of your system. So this intrapleural pressure plus elastic recoil pressure must be above your airway pressure. It must be above your airway pressure. So I'll write this as intrapleural pressure IPP plus elastic recoil pressure. So which must be above your airway pressure to drive out the air out of your system or your lungs. So because in COPD there is decrease in elastic recoil, pressure, the sum total of intrapleural pressure plus elastic recoil pressure is always below the airway pressure, and it always tends to go below the airway pressure. Because of this, airways will close. So because of this, airways will close. Then comes the second stage, which is an air trapping stage. So why are these patients are unable to expire this air? Because the theory of dynamic compression. Theory of dynamic compression says that the sum of the intrapleural pressure plus the elastic recoil pressure is always above the airway pressure to exhale the air out. So that's why in case of COPD, so the patient is unable to expire the inspired air. So which is easy. So in a COPD patient, which is easy to inflate the lung, but difficult to exhale out. So which is very difficult to exhale out. That's why there is a air started to trapping inside the lung. Okay. So summing up all the discussion we have discussed about the COPD and FVC ratio is, so in a case of COPD or in an obstructive lung disease, what happens is that there is a decrease in FEV1 by FVC ratio is always low, which is less than 80%. And also in case of forced vital capacity, it might be normal to increase, and also there is increasing residual volume and FRC. So after increasing residual volume and FRC, ultimately total lung volume or the total lung compliance is also increases so much. So getting back to our question, decreasing in peak expiratory flow rate. So I have not explained this peak expiratory flow rate. So this peak expiratory flow rate is amount of air which is exhaled forcefully out of the lungs in a one exhalation. So of course peak expiratory flow rate is also decreased because the patient cannot expire as forcefully as he can because of closed airways. So peak expiratory flow rate is also decreased. So this is also a correct choice. Option A is also correct choice. Of course we have seen in obstructive lung disease FEV1 is also decreased, and this is also a correct choice. And increasing in FEV1 by FEC ratio, is that correct? No. What we have seen in obstructive lung disease, there is a decrease in FEV1 by FEC ratio. So FEV1 by FVC ratio is not increasing in obstructive lung disease, and FEV1 by FVC ratio is decreased. Of course, this is correct, and the option and the choices which are correct is A and B and D. So this A, B, D option 4 is correct. So this is how you have to learn each and every topic, and this is how you have to evaluate each and every MCQs. So in the earlier phase, which seems like very much time consuming, all these questions and all these topics. So if you start studying from your UG days, it will be very much useful, and it will be very much easy when you're in the internship. So that's why there is a rooted knowledge, and the rooted concept base is very much important. And in the future, the examination, the APGT and PG entrance examination will be more difficult and will be more clinical than this. So try to learn from the root. And for the further more explanation regarding this obstructive lung disease and FEV1 by FVC ratio and spirometer and plethysmograph, and we'll discuss everything in a class. So we'll that too we are starting soon. So I will discuss FVC and FEV1 by FVC ratio in terms of restrictive lung disease, what happens in restrictive lung disease, and all those things. We'll discuss in detail about respiratory and the respiratory system and medicine and pathology in general in the classes. As far as MCQ is concerned, I think this is more than enough to discuss. So if you have any doubts or anything, you can directly DM me, and we'll see you later in the classes. Thank you.